Thank you. Well, if you've ever been to the emergency room, you probably know what it's like to rush to the hospital only to wait and sometimes wait a little longer. And if it feels like you're waiting longer these days, well, you could be right. New numbers out today from the Centers for Disease Control show that the average time people waited to see a doctor in the ER was 38 minutes in 1997. You see the numbers here. In 2004, it took 47 minutes, and the most recent numbers, it's up to 56 minutes. Our Sonia Gant joins me now. Sonia, why are these numbers going up?
Well, we went to a doctor today to help us kind of understand the situation. We talked with Matthew Sullivan. He's over at CMC, and he says there are several reasons why.
One is a lack of health care for some citizens, and the other is a lack of care where they can't get in to see doctors. And the other is that there are less emergency departments now than there were 10 years ago by a fairly high percentage.
Now, as for those wait times, now keep in mind the CDC says the average for an emergency room visit is 56 minutes. Of the 5 Carolinas Medical Center hospitals that you see listed there, the longest wait in the month of June was at CMC University. There, the average wait was about an hour and 7 minutes. On the other end, CMC Northeast in Concord came in with the lowest wait at 41 minutes. We also called Presbyterian Hospital today. They said they didn't have exact numbers on wait times, but they were somewhere lower than the national average. The hospital says it's the only one in the Charlotte area that does not take people by ambulance to other hospitals when emergency rooms get busy.
Okay, so all of that information begs the question, how do you cut down on those wait times?
Because, of course, that's what everyone wants to know if you have to go. Well, at CMC, what they're doing is trying to do a better job at sorting out patients. They're setting up a physician triage, which basically helps get certain patients to the doctors or nurses that they need to see. Dr. Sullivan says it really is also going to take some understanding on the part of the public.
I think an understanding is important for the public, an understanding that when they come to the emergency department that there may be a wait, and to be patient, and also try and do the best they can to get in and see their regular doctor for basic routine stuff and reserve coming to the emergency department for true emergencies.
And Bobby, here's an interesting note from the CDC. They found that summer and winter, surprisingly enough, the busiest times at the ER. And keep this in mind, even though some people had really long waits, really most people are getting in about a half hour or so. And so that's not bad when you consider you're going for an emergency. They have to prioritize you. So.
Yeah, and you're there and you want to get in really quickly, but sometimes there's so many people ahead of you. So I guess
your
it all makes sense.
emergency may be not as much an emergency as someone else.
Still some good information to think about. Okay, Sonia, thank you.